Hi everyone, let us discuss MCQ of APGAR score. So here you can see detailed information about the APGAR score system, and nothing but this tool is a standard tool. Generally we can use for evaluating or recording physical condition of the baby after birth, and it should perform within 1 and 5 minutes after birth. And in this we check mainly 5 indicators. One is appearance, pulse, grimace, activity, respiratory effects. So these are vital indicators we need to check after birth, and these indicators tell us whether the infant has good physical condition or not. And the total score of this APGAR is 10. You can clearly see here. First indicator, appearance. Nothing but color. So after birth, we have to check the appearance of the baby. If the baby born in blue color or yellow, have to give score 0. If the baby body is in pink color or extremities in blue color, have to give 1. Or if the baby body is in total body is in pink color, have to give 2. So this is a normal score. So this is the average. Okay, average score, and this is the 0. Okay, the next one, have to check the pulse rate. If it is absent, have to give the 0. Less than 100, have to give 1. And the pulse rate more than 100, have to give 2. Grimace, reflexes, if there is no response from the baby, have to give 0. Grimace have a normal response, then have to give 1. And if the baby crying, coughing and sneezing, have to give 2 marks. Then have to check the muscle activity. If it is in flaccid condition, 0. And if you are seeing some flexion from baby, have to give 1. If the baby has good flexion, then have to give 2. Then respiratory rate, have to check. If it is absent, 0. Slow breathing or irregular breathing, 1. Good crying with a good respiratory rate, have to give 2. So now let us discuss MCQ of it. So first question you can see, DAS is a means of standardizing the method of evaluating and recording condition of the baby in numerical terms at 1 minute after birth, if necessary after 5 minutes. And the answer is APGAR. APGAR score is a standard tool used to evaluating and recording physical condition of the baby by using these numerical terms. And duration of doing this is compulsory within have to complete 1 minute to 5 minutes. Yes. Okay. The next question. Quantitative assessment of neonate condition at birth is done by. Answer is APGAR score. Then APGAR score is recorded. Already we have discussed here. It should perform at 1 and 5 minutes of the birth. So within 1 and 5 minutes of birth have to record. The next question. APGAR score of newborn immediately after the birth is checked within 1 minute. So here they didn't mention 5 minutes. Okay, so they given 1, right? So APGAR score within they asked in APGAR score of newborn immediately after the birth is checked within 1 minute. The next one, APGAR score is considered excellent if the score is if the baby has score 7 to 10, then you can consider it as a normal score. 7 to 10 considered as good to excellent, and 4 to 6, the score 4 to 6 is fair or mild depression, and if the baby has less than 4, then the baby has poor physical condition, severe depression, and is in asphyxia, then immediately have to start the resuscitation process. 7 to 10 normal, 4 to 6 fair, and less than 4 is a poor physical condition. The next question, the normal APGAR score of newborn is. The normal score of newborn, already we have discussed here. The answer is 7 and above. Then Severe asphyxia or lack of oxygen to the brain. Severe asphyxia is indicated by an APGAR score of. Severe asphyxia, already we have discussed here. Okay. So if the baby has score 0 to 3, less than 4, we learned here. If the score less than 4, so nothing but 0 to 3. If the score is 0 to 3, then the baby has severe asphyxia problem. The next one, which is the one score of APGAR score of newborn? In given options, which is the one score of newborn? APGAR score of newborn. Heart rate above 130 is a normal indicator. Okay, so already we have discussed here. Heart rate or pulse more than 100 considered as normal, so have to give the 2. So this is a normal. Here heart rate is 130, more than 100. Then flexed body, yeah, good flexion, then have to give 2. This is also normal. And blue feet. So here you can see appearance or color. So if the body is in total pink in color, have to give 2. So here the baby has a blue feet or blue extremity, then have to give the 1. So this is the one score of blue feet considered as one score of APGAR score. Crying loud is also normal response. Have to give the 2 marks. The next one, all of the following are included in APGAR score except. All of the following are included in APGAR score. Intensity of crying is not an indicator of APGAR score. Then APGAR score includes assessment of. APGAR score includes assessment of reflex, grasp, pulse. So here we are not checking sleeping pattern, we are not checking behavior of the infant, and we are not checking activity, behavior, respiration, color. So this is a correct answer. We are checking reflexes, grasping, and pulse rate of newborn. Then next question, which of these parameters should be assessed during first minute of life in a newborn? In these parameters, which parameters we should be assessed within first minute of life? The answer is, so temperature is not a parameter. Checking head circumference is not a parameter of APGAR score. Gestional sex, muscle tone is not a characteristics of APGAR score. So this one, option D. Color, respiration, heart rate, we need to check. The next one, APGAR score is a measure of all except. APGAR score is a measure of all except. We are checking respiratory status, neurological status, reflexes we are checking, right? Reflexes is nothing but is related to neurological status, right? Neurological status we are checking, cellular status we are checking, but we are not checking any nephrological status, nothing but related to kidney. So these 3 are we are checking in APGAR score, but except this. So the answer is nephrological status. Thank you all. In next class, I will come back with the remaining MCQ. Thank you.